Hello, my name is Alfonso Martinez, family nurse practitioner student, Maryville University. This is patient CM. He's a 42-year-old male. Before we had come into the room, I had CM empty his bladder. And your bladder is empty?
Yes.
Okay. I also examined his gait. His gait was normal, without any unsteadiness at all. We also took his vital signs, his heart rate, respiratory rate, and blood pressure. We did not do a vision acuity test. He is corrected, although he has taken his glasses off for this physical exam. First of all, I'm going to check his head and face. I'm going to visually inspect for any sort of lesions anywhere along his skin, and I do not see any. It all looks within defined limits. I'm going to go ahead and feel for any tenderness or crepitus. Do you feel any pain or tenderness when I touch your skull?
No.
Alright. I want you to go ahead and do a few little tests for me. Can you wrinkle your forehead for me? I want you to squint your eyes as hard as you can. Can you clench your teeth? I want you to stick your tongue out straight. Can you move it side to side? Can you puff out your cheeks? Excellent. I'm going to go ahead and feel right in here, the temporomandibular joint. If you can open your mouth for me and close it. I do not feel any clicking. Do you have any pain or tenderness when you do that?
No.
Okay. I'm going to go ahead and palpate for sinuses. Do you have any pain or tenderness in your sinuses when I push in here?
No.
Up in here?
No.
And inside here?
No.
All right, excellent. I'm going to go ahead and test for light sensation. Just tell me if you can feel this.
Yes. 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 Yes.
Very good. Next, I'm going to go ahead and examine his eyes. I'm looking for any sort of lesions on his eyes. Go ahead and close your eyelids. I do not see any lesions. Hair distribution on eyebrows and eyelashes are within defined limits. Go ahead and open your eyes. Sclera is white and clear. There are no signs of any trauma or other injury. I'm going to test him for red reflex. If you could stare straight ahead at the wall, please. And we have positive red reflex in both eyes. Once again, we're going to focus on his nose. And did you have any pain or tenderness in your nose at this time?
No.
All right, I'm going to palpate up on top. Any pain or tenderness when I touch your nose?
No.
Go ahead and I want you to close one of your nostrils with your finger and breathe through that nostril. And go ahead and repeat that on the other side. I'm going to look inside of his nose. Inside I see normal hair distribution. I do not see any polyps. I do not see any lesions. If you can open your mouth for me, please. As I look inside and looking at dentation, I'm looking at the gingiva. Go ahead and keep your tongue inside your mouth for a moment. And see. The inside of the buccal membranes are without any lesions. Hard palate is intact. Soft palate is intact as well. I'm going to have you open up your mouth, please. I'm going to look inside. Lower teeth are intact. There are some repaired caries. Go ahead and stick your tongue out for me. And say ah.
Ah.
And check his gag reflex. He's positive for gag reflex. Next, I'm going to test hearing acuity with a tuning fork. And I'm going to place this right on the top of your head. Let me know if you can hear the sound greater in one ear than the other. Or if it is equal.
Seems equal.
Okay. Next, I'm going to test for conductivity hearing. Tell me when you can no longer hear the sound.
Now.
And air conductivity, tell me when you can no longer hear the sound.
Now.
Repeat this on the other side. Tell me when you can no longer hear the sound.
Now.
Tell me when you can no longer hear the sound.
Now.
Very good. I'm going to further assess by palpating the lymph nodes. And tell me if you feel any pain or tenderness.
No. 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 No.
I'm going to palpate the neck. I did not feel any large nodules. And I do have a midline trachea. Thyroid is soft and without lesions. Do you feel any pain or tenderness?
No.
We'll further palpate down. And I do not palpate any additional nodules. I want you to go ahead and I'm going to test his symmetry with his range of motion on musculoskeletal of the upper body. Can you push up against my shoulders and shrug? Very good. Can I have you place your arms straight out? And I want you to push up against my arms. And push down against my arms. All right, place your arms out to the side. I want you to push up with your arms. And once again, down with your arms. Okay? With your arms still out, stretched, I'm going to palpate axillary lymph nodes. I do not feel any nodules. And place your arms down. I'm palpating for supraclavicular nodules. And not feeling any. At this time, I'm also going to start assessing his cardiac. I'm going to place my hand and feel for his PMI and his left sternal border. And take axillary pulse. As you may be able to hear, there is a clock behind me that is ticking rather loudly. Very good. It is consistent with the heart rate that we received before. Now with my stethoscope, I'm going to start to auscultate. I'm going to begin by auscultating his coronary artery. I'm sorry, carotid artery. If you could hold your breath for 1 minute. Placing the bell gently across his carotid. Very good. Relax. I did not hear any bruise. I did not feel any thrills when I palpated. Go ahead and listen to your heart. Just breathe regularly. Listening to yours. I hear no murmurs. There are no clicks, no rubs, no arrhythmias. Once again, no clicks, no rubs, no extra sounds. I hear only S1 and S2. I'm going to go ahead and auscultate lung sounds. Hey, have you take a deep breath, please. And out. Deep breath in. And out. In. Out. In. Out, in, out, in, out, in, out, in, and out. Let me catch his breath for one moment. Do you feel lightheaded at all?
No.
Do you feel any shortness of breath?
No.
Lung sounds were clear. There were no rhonchi, no wheezes, no crackles. I'm going to further evaluate lung fields. I could have you put your arms out to your side. Take a deep breath in and out. In and out. In and out. In, out, one more time, in, out, in, and out. Go ahead and place your arms down, thank you. And take a deep breath in, out, in, out, breath in, and out, in, and out, in, and out, in, and out, and last time, in, and out, in, and out. Once again, breath sounds were clear to auscultation. I did, however, hear some vowel sounds, meaning that I need to feed my volunteer some lunch pretty soon. All right. All right. Next, I want to go ahead and feel for your upper extremity pulses before we lay you down for abdominal exam. I could have you put your hands out. If you could twist them back and forth. You're looking good. And testing for capillary refill. It is less than 3 seconds. Less than 3 seconds on all digits. I'm going to feel for radial pulse. Good. Check bilaterally for equalness. Pulses are equal bilaterally. Checking for brachial pulse. Brachial pulses are strong and equal bilaterally. Have you lay down, sir? I'm going to begin by once again auscultating the heart. Once again, no bruits, no murmurs, no extra sounds, even with the position change. And we pull your shirt up slightly for me, a little higher, kid. There you go, to the base. Then we examine his abdomen, by shining a light across. I'm looking at the level of the abdomen. I'm looking for any bowel loops, any areas that are standing out higher than others. I'm also looking at hair distribution. I'm looking at any signs of lesions or any other visual abnormalities. And I'm not seeing any at this time. At this time, I'm going to begin to percuss. I'm going to begin by percussing across the abdomen. And with percussion, I do hear tympani over air-filled organs. I do feel and hear dullness over solid organs. I'm going to begin by a light palpation. I am feeling for any lesions that may be directly underneath the skin, any sort of nodules. Do you feel any pain or tenderness when I touch your abdomen?
No.
Now I'm going to begin a deeper palpation. I'm assessing for hepatomegaly at this point. I can feel the beginnings of the hepatic margins at this time. Any pain or tenderness when I push a little harder?
No.
I'm feeling for the spleen. I do not feel the margins of the spleen, which is normal. I'm going to feel for any deeper organs, and we're feeling for kidneys. Kidneys feel normal. And although I did the palpation first, you should always auscultate before you palpate. I'm actually going to go ahead and auscultate now. I have very, very active bowel sounds. Right upper quadrant, right lower quadrant, left lower quadrant, left upper quadrant. I'm going to switch to the bell. I'm going to listen for the aorta. I do not hear any turbulent flow. I do not hear any bruits. Listen for renal arteries. Once again, no bruits. Listen for iliac artery. Bilaterally. blood flow. And finally the femoral artery. Bilaterally, we have no bruise. Thank you, sir. You may sit up. At this time, I'm going to check his lower extremities. Begin with his pulses. Check popliteal pulses. Anterior tibial pulses. They are equal, as was the popliteal. And now the dorsal pedis. I am palpating pulses. I'm looking at the skin for any other lesions. I do not notice. I know some very small pinpoint hemangiomas. Nothing to be concerned about. Hair distribution is normal between the two. I do not see any edema whatsoever. I'm going to carry on with the reflex tests. I'll begin by testing the brachial reflex. Positive. Positive. It's radial reflex. Positive. Positive. Positive reflex. Positive reflex. And he has had prior Achilles injury, so I'm going to very delicately check Achilles reflex. Positive. Positive. Now looking at his toes, I'm going to once again check capillary refill. They're within 3 seconds. Less than 3 seconds bilaterally. I do notice his toenails, he does have an area of, looks like blood trauma. Clean my hands. Sir, if I could have you stand up off the side. At this time I'm going to check his spine for any curvatures. Standing up, I'm feeling through his thoracic and lumbar spine. I'm not noticing any deformities. I could have you bend over and touch your toes, or as far down as you can. And with him bent over, I'm also finding no deviation of the spine to the lumbar region. Feel free to stand up, sir. And that concludes my assessment of patient CM. Thank you.